have their own health departments. Usually it's a county level thing. But Berkeley has its own health department, and we do health status reports every couple of years. And these statistics that we keep seeing replicated every single time. People of color, communities of color, poor people are suffering disparities. So, you know, some of us were at the table because of this. I want to take a step back, and then I'll come back to Berkeley in a second. This is the frame of mind that I had kind of coming into this. If you go to the CDC website and you look at the greatest public health wins for the last century, all of these are all the wins that they have on their website. But I've actually gone in and I've looked at every single one, and I find that communities of color and poor communities are not benefiting the same. It's part of this thing again where we keep being shown statistics that have become normalized. And so it shouldn't be normal. So, you know, I'm coming into this with, well, there's interventions that we've been doing that are reaching the broad swath of the middle, but they're not reaching our communities. So what is it that's going on? How do we take that thinking into this campaign? Another thing is that health justice for us is social justice. A couple of slides later, I'll talk about very briefly about the social determinants of health, which I'm sure all of you as health people probably know them better than I do. But this is a slide that shows you know, differences in life expectancies depending on your zip code. You can move 3 miles and you can see life expectancy different. And it's nothing that the children that are being born that day have done. It's just by virtue of being born where they're being born. There are things in the environment that give days of health, and there are things that take away days of health, or if they're not present, days of life are taken away. Another thing, another framing, and pardon the baseball thing, I really don't like this because sometimes people will start to focus in on why are they trying to get a free baseball game. That's not really the issue here. The issue right here is that, you know, for a long time we talked about equality. Equality is giving everybody the same supports. It's not recognizing that different communities have different needs. So then, you know, we're talking a lot about equity right now. Well, let's make sure that the interventions that we're giving are actually appropriate to the community. But we actually need to take it even a step further. Everyone in the community is not the same, and the barriers that they are experiencing are not the same, and the ground that they're on is not the same. So while public health, we study and we learn how to do messages that reach the broadest swath of people, or interventions or policies that reach the broadest swath of people, what's happening is that there's many communities that are falling through the cracks, and they keep coming up in these statistics. Another thing that's going on in our head as we're trying to prepare how to get involved. So this is the social determinants of health. It's the one that we use at Praxis. So in a community, in a zip code that has all of these things present right here, people live long lives. When you have some of these things not robustly present, people's lives are shortened. So this is framing. This is what we bring to the table. And I think we can get the slides to folks, so if I saw you taking a picture. So, Berkeley, back to Berkeley. So political and public health tensions. The reason we wanted to pass a tax, or the organic reason, was because we wanted to fund popular-based cooking and gardening programs. A number of us came to the table and said, we also want to invest in communities most affected by chronic diseases that result from the overconsumption of SSBs. And we also want to make sure that the investments that we make leave capacity behind. We want to make sure that communities have greater capacity to do this work, whether they're working on SSB or something else, childcare. We want to make sure that we increase resiliency of the organizations that are working to improve health. This isn't just raising the price so that poor people will choose a different drink. That's one way to get people to drink less, but that's not a sustainable way. It's typically not a way that needs to engage communities and bring them to the table. It's to me, it doesn't feel good. You saw the way the pricing was in the beverage industry coming in and saying, you are now paying more for your drink. You know, why don't we flip that and say, in our communities, we are now receiving these programs and resources because of the tax. We don't see any of that going on. Make sure the price increase was significant to deter purchasing. So Berkeley passed a 1-cent tax. We'll talk a little bit more about that. but the public health dogma was 2 cents per ounce is what would get people to change their behaviors. Berkeley came in with 1 cent. The second thing, make sure the purchaser felt the price increase at the register. Another main thing was they wanted folks to see that there was a soda tax at the bottom of the receipt, like he was talking about earlier. And for some of us, kind of like, not sure if we want to rub people's noses. Consumption of sugary drinks. Success was defined by increasing community knowledge and behavior changes of folks receiving benefits of investment. So it's a little bit different from raising the price so that people can't afford it. All right, how much time do I have? I said way too much time. 7 minutes? Oh. All right, another thing that we did, Berkeley had talked to other municipalities that had failed to find out what happened, and what folks came back with was, you need to have diverse people at the table, the people that the beverage industry will go in and target and bring them to the table, have them help you craft the legislation. So we were part of the previous slide where we changed our requirements. But also, again, we can't say with specificity that this is what we did, but our intention was that 42.5%, up to 42.5% of the funds would go to school-based cooking programs. At least 42.5% would go to community-based programming, 10% going to the city to cover costs of administering the program, 5% to the Department of Public Health to support external and internal evaluations. There's a lot behind this. Some of us didn't want 100% of the money to go to cooking and gardening programs in schools. The reason was equity. Berkeley's it's gentrifying really fast. We felt that this is not really a draw for our communities, but it's a draw for other communities who could afford to move there. And so as they're looking across the bay, looking at San Leandro, Oakland, other places, they might be drawn to Berkeley because, hey, it's got a cooking and gardening program. We wanted money to go directly into the community that was going to be paying higher taxes, and also to make sure that it was the programming there was supported. The beverage industry came in hard. Really hard. And the way we fought back was not with a lot of money, because we didn't have a lot of money, but because we had buy-in from the community, because we had been at the table from the very beginning and helped to craft the measure, and also had agreement on where we intended the funds to go. When you get the community bought in like that, they will go to the mat for these things. And so this is folks getting trained to go canvas. We had house parties. They were called house parties. I'd never heard this before, so I don't know if it's a Berkeley thing. House party means something totally different to me, but they had house parties where they bring folks together, and we taught each other about what was going on with the tax. We literally went street by street, block by block, house by house, and we did it repeatedly to make sure our community knew what was happening. And so we ended up winning at, this is wrong, we won at 76%. So it was huge. We actually gone up. Initial polling said that before the beverage industry came in, we were at 66% approval. We thought once the beverage industry came in, we'd probably do a dive, and that's why we chose to do the 50% with the expert panel. I'm running way out of time, but here's our goals. This is embedding. This is the goals of the sugar of the funding, where we wanted the funding to go. To reduce access to sugar-sweetened beverages. I'm just going to read this because it's going to be the fastest thing, sorry. Improve access to water, limit marketing of sugar-sweetened beverages to children, implement education and awareness programs with specific populations, including measurable outcome data, develop multi-level interventions that include education, institutional change, policy, system, and environmental change, promote consumption of healthy beverages, prevent conditions related to consumption of sugary drinks, including diabetes, dental caries, obesity, and heart disease, and decrease health inequities related to diet-related illnesses. Those were that's a lot of goals. Priority populations. We hardwired this in, and this is the result of having diverse people around the table. Children and their families, with a particular emphasis on young children who are in the process of forming lifelong habits, individuals with limited resources, groups exhibiting higher than average population levels of diabetes, obesity, and tooth decay rates, groups that are disproportionately targeted by the beverage industry. This is actual language that's written into our request for proposals. We had priority strategies. I'm sorry, I'm not going to read them because I'm running out of time. We can get the slides out maybe? Priority outcomes. We want to, and the one I want to get to, proposed scopes, works of activity, requirements, scoring criteria. Proposal shows evidence of decreasing consumption of sugary drinks and or addresses the health effects of the consumption of sugary drinks, 15%. Proposal reaches priority populations, 15%. Proposal includes policy, organizational practice, and or strategies to improve the beverage environment, 10%. Proposal includes partnerships and collaboration, 10%. Proposal builds capacity and or has elements that are sustainable beyond the grant period. Proposal has a reasonable timeline and is feasible, and it matches the work plan and describes the related work experience. But you know, we layered health equity into every single step of how we were giving the money. And so we've got near universal support in Berkeley for what we're doing. And so, you know, when you think about working with community, I'm not stretching when I say if the community is bought into what you're doing, they will go to the mat for these policies. You don't have to message for regressivity. You have to do a lot of community education mobilization, and you do that best through working in partnership with community organizations, empowered community organizations. I mean, and I've got a few slides here. Food justice, I think of this. Parks justice. These are people that actually went out and built a park where they're going to build a sheriff's subway station. Environmental justice. Hope justice. Transportation. You got groups out there, and these are all the social determinants of health. You got folks out there that are pounding the pavement right now that are ripe allies for anything you guys want to do in this state. Economic justice, education, healthcare, immigration. So, you know, the important thing is the beverage industry comes in, not just the beverage industry, all industries come in and they drive wedges between communities. By bringing all those communities together up front and listening and engaging them, getting their buy-in, finding out what their priorities are. You know, our priority, yeah, we want to reduce sugary drinks. What's your priority? You want to get rid of the, I don't know, rats? I'm making that up. You know, is that your priority? Well, then, you know, how can we do both? How can we do both? And there are ways to do both, but we just have to be real creative. Those discussions that we had early on in Berkeley were not easy discussions. They were hard discussions. People got angry with each other. But we worked through them, and we came out stronger because of that. And now, you know, I don't think our tax will ever get repealed in Berkeley. Knock on wood. So, you know, it's just to do this work, to do it right, to reach those places where mainstream efforts or mainstream efforts are not reaching. We need to do it in partnership and authentic partnership. Thank you.
Thank you, Javier. So we're going to take a few minutes to answer some questions. But before we do that, a little bit of housekeeping. Public safety has asked us if the folks who do not have a seat and who are standing, if you could move over to room 717, which is our overflow room. You know, we being public, right, if the stream is working in, we being public health professionals, we want to be respectful of public safety and, you know, make sure that we're keeping everyone safe. So if you have a question, feel free to stay for a few minutes to ask your question, but if not, if you could go to the overflow room, we'd appreciate it. Thank you. So we're going to open the floor up to some questions. What we're going to do, we'll take 2 or 3 at a time, and then Javier can answer them.
So I've seen a couple of things about when people tried to pass these taxes, they wanted it to go to the companies where it was hit and not to the consumer. Did this tax not result in an increase in the price of the sugar-sweetened beverages in stores? Like, was it only paid by the companies, or did it end up affecting the consumers as well?
I'll answer it while somebody else is raising their hand. It's an excise tax. It's at the distributor level. Whether it gets passed on or not is up to the retailer. Or the distributors have been increasing the price for the most part, but the retailers may not have been. And research in Berkeley shows that I think only like 2/3 of a penny has actually, on average, has been passed along. With gasoline stations actually raising the price and blaming it on the tax, like, a couple of pennies. But like Walgreens or CVS, places like that, it hasn't gone up. So about 2/3 of the cent.
Yeah, you mentioned that promoting healthy beverages is one of the tactics. What are healthy beverages that you promote aside from water?
Water. Things with less sugar. Things with less to no sugar. There are drinks out there, and many more of them are coming onto the market. A lot of carbonated drinks now with no sugar. So yeah, that's what we promote.
Thank you for that. Could you speak to evaluating the campaign as you go along? Because there were a lot of statistics, and it seems as if you guys did a lot of research, or at least figuring out where you were in terms of the vote. Did you have an outside organization help you with that? And how was that incorporated?
We had council members, we had politicians that were on our commission or on the strategic planning committee, and they had access to polling. And so early on, we did polling to find out, early on at the very, very beginning when there was an idea, we did polling to see where we stood. We did polling again right before we asked the council to put it on the ballot. And then there was polling that was done throughout. And the most important numbers are that 66% of Berkeleyans said that they would vote for this tax. But that was before the beverage industry came in. And what we had learned from other locations that had tried to pass is that if communities of color come out against this, chances are, as liberal as Berkeley folks are, they would probably not vote for it because it may be perceived to be hurting a population that they care about. So that's why it was so important to make sure that we brought everyone into the round table.
Hi. I was wondering if and how you might have involved youth in this project, and if so, if that involved direct outreach to the schools.
So during the campaign, youth were heavily involved. There's a retail place called the Ecology Center. It's kind of like a nonprofit green eco center, and they run youth programs. They run our farmers markets in schools as well. And so they brought on a cadre of like 6 youth, trained them on why it was so important on what we were doing. They got so excited about it. They bought into it, and I was fortunate enough that I was precinct captain for District 2, which was the most diverse district in our town. If there were folks that were going to come out against us, it was in my district mostly, and I was able to get the Ecology Center youth to come work with me, and we hit the streets every weekend for like 10 weekends, and they were incredible. Best spokespeople.
Hello. Hi. Going back to the question about what's considered a healthy beverage, did you include those with non-nutritive sweeteners in that category as a healthy beverage?
We didn't call out the chemicals or the non-nutrient sweeteners. We just say water, just lower sugar. Also you got to remember this is a political campaign, and so some people have faulted us because we didn't include flavored milk. Some people have faulted us because we didn't include juices. There are people that feel like you shouldn't even have, fruit juice. But in a political world, right now, we have the beverage industry we're fighting against. If we start wanting to include flavored milks, all of a sudden now we got the dairy industry. If you want to include some of these other things, it's like you got to be strategic in who your opponents are going to be. And so we were deliberate in trying to be really laser focused on sugary sweetened beverages. Now, afterwards, a lot of the campaigns we're funding are water-based campaigns. We have a cadre of youth from the same Ecology Center. They got a grant to do. They have water ambassadors, and it's pretty. Berkeley High, the first day of school, they have like this table where they give every single freshman a water bottle, and they talk about why it's so important to drink water, and they've actually paid for hydration stations where kids can go fill them up. So they're trying to make that the easy choice as well.
Thank you for that great story. What I want to know is a little bit about the messaging of, that is incredible that it went up and you won by more after the industry came in. So what was the messaging that actually resonated with people that kind of fought the industry messaging?
We started our work, we started meeting. I was brought to the table in October of 2013. There were people that had been meeting since June. And so we actually hit the ground in July. The election wasn't until November 14th. And so the beverage industry didn't show up until September 1st. So we went from July through September without the beverage industry showing up yet. And what we did is we went around and we talked to our neighbors, and we said, this is the sugary drink tax, this is how much it's going to be, this is what we want to use the money for, this is why it's not going to affect retailers. We just explained everything. And then we'd say, and the beverage industry is going to come in any moment now, we don't know when, they're going to come in heavy, they're going to be overwhelming. And we just they're going to say it's regressive, they're going to say it's nanny state, they're going to, all the things they say. What questions do you have? And then we would answer all their questions, and we're like, okay, anything else? We spent a lot of time going door to door. And so when the beverage industry came in, they did everything that we said they were going to do. And so it's unheard of that in a tax campaign, especially, you go up. You always expect to go down from the polling, initial polling. This is like one of the rare cases on a tax campaign where it went up more than 10 points.
So you said, whoa, not used to a microphone. Berkeley is a relatively small city. So the going the door to door and talking to everyone, how would that work in a bigger community like New York City or Los Angeles or a statewide?
Engaging communities, engaging key community organizations, making sure that leadership understands what's going on, why you're doing it, get them bought in, and then figure out, help enable them to go out and reach their constituencies. It's through community. For me, it's the groundwork through community. You can do the messaging on TV, but I'll tell you that the beverage industry has so much money that it's really hard to message against them. You're on their playing field when you start doing that. But when you start going door to door, it changes the game. And if you have people who are likely to be the ones opposing it, going door to door and advocating for it, it changes the game. So it's hard, but you got to start early, and you got to be real targeted with your messages for each community. What might work in a Puerto Rican community may not work in a Dominican community, may not work in a Mexican community, may not work in an Asian community or an African American community. So you have to. That's why it's so important to make sure you're working with organizations from each of those communities to find out what works. What should we be talking? Should we talk about diabetes, or should we be talking about lead in water, or what is it that we need to be talking about in your community to get the support? But then you also have the burden of following up and making sure if you do pass the tax that the money actually goes into those areas.
Thank you. Thanks again, Javier. So now we're going to move into our panelist portion of today's event. If our panelists could come up and have a seat on the stage. Okay, so a little bit of additional housekeeping for the panelists. The folks in the Overflow Room asked if you could speak directly into the microphone and very, very forcefully and fully so that they can hear. Apparently it's cutting out a little bit there. So I'm going to pass it over to our director, Dr. Nick Freudenberg, and he's going to introduce the panelists. And they're each going to give a short 5-minute or so presentation and then move into the panel discussion.
Thank you, Craig. And a big thanks to Craig for organizing this event with our partners and others. So welcome. And for those of you in the Overflow Room, we'll occasionally send runners in to see if you're having any problems. We'll try and talk loud. Let us know if we're not. And during the question period, we'll also send runners in to see if you have questions, and if you could write them and bring them in. They will be regarded, given priority over the people who get to sit in the room. So I think there are a couple questions that we hope to address in this panel and the rest of the day that are really, as Craig explained, some of our goals for this meeting. First, there's a rich body of experience around the country, and we heard about some of it from Javier, and here in New York City around working around sugary beverages. What are the lessons from those experiences? Second, that there have been a variety of strategies tried to reduce consumption of sugary beverages, and some of the handouts that are in your packet explain what some of those strategies are. What are the strengths and weaknesses of each of those strategies, so that as we begin to make decisions how we want to proceed in New York to move forward with further reducing consumption of sugary beverages, we can pick the right strategies. And from that, the third question is, what's the ideal package or portfolio of strategies? We learned very clearly from tobacco, there's not one thing you can do. You need to do a lot of things. And in general, the lesson from tobacco is the more we did, the more success there was in bringing down smoking. So what's the package in sugary beverages? And also, how do we set priorities? What do we do first and second? And finally, and in some ways most important, how can we and the people we work with work together next week and next month and next year to make measurable progress in this time where I think many of us feel there's a real window of opportunity to make progress. Let me tell you about our speakers, and as Craig said, each of them is going to talk for a short 5 minutes because we really want this to be interactive. I'll have some questions for you, and then we'll open it up for questions from you. First, we'll hear from Fran Fleming-Milici. She is a research associate for the Rudd Center for Food Policy and Obesity. She joined the Rudd Center's marketing team in 2011, and her work focuses on analyzing racial and ethnic differences in rates of exposure to advertising of unhealthy food and beverage, and assessing the impact of targeted marketing. The second, we'll hear from Jim Krieger. He's the founding executive director of Healthy Food America and a clinical professor at the University of Washington School of Medicine and Public Health. He previously worked for 25 years in the Seattle and King County Public Health Department as Chief of Chronic Disease Prevention. Jim has provided technical assistance for adoption, implementation, and evaluation of sugary drink taxes and other policies in cities and counties across the U.S. And he serves on Seattle's Sweetened Beverage Tax Community Advisory Board. And finally, we'll hear from Juan Carlos Gonzalez. He's the program manager at the Children's Aid Go Kids program, and since 2003, this program helps provide nutrition and wellness education to children participating in Children's Aid Society early childhood classrooms. As a health educator, Juan Carlos is passionate about how design and education can assist parents and staff in exploring and implementing strategies to minimize the impact of stress and aid in living healthy and active lifestyles. What a wonderful panel representing such diverse points of view. Fran, you want to get started?
Hi, and I am excited to share some of these slides here with you. Before I begin, I need to point out my research area has focused on targeted marketing, and the effect of such marketing. But some of the pictures I have up here sort of show you what you're up against. That one picture of Selena Gomez there was the most liked picture on Instagram. And I think that maybe if you won't use Instagram, you have children who do. So you could imagine the competition. And it stayed that way until Beyonce unseated that with announcement of her twins. So this is the kind of marketing that the industry has out there for you. So good luck to all of us. So I won't go into this too much, but I think I want to point out the second bullet there. Even more recent research shows that the consumption of sugary drinks is still pretty popular. So nearly a third of youth still consume 2 or more sugary drinks per day. And I think Craig pointed out the differences by race and ethnicity in consumption. Those differences hold when we compare lower income versus higher income youth too. And in 2005, the Institute of Medicine put together a very big report to look at the marketing and found out that marketing of foods really doesn't match up with what children should be eating. And since then, and prior to that, and since then, a lot of work has been done on what marketing does. So I could go into great detail here, but marketing works. It increases children and adolescents' ability to recall brands, and it influences what they prefer, and it also influences their requests to parents. And all of this influences consumption, and we know that's related to diet-related disease. The other thing I need to point out here is that it's not just affecting children. We did a study a few years back and asking parents what they thought were healthy drinks. And you can see by these numbers here that we might have done a pretty good job here in what's going on in terms of attitudes towards sugary drinks, carbonated sugary drinks. But there's still a problem when it comes to fruit drinks and sports drinks. So people think that they're healthier, and people who purchase them think they're healthy too, and maybe even more so than others. So what policies would impact the marketing of sugary drinks to children and adolescents? When we consider marketing, and people think of ads or advertising, and that often comes up in terms of billboards or TV ads, magazines, a little bit dated, or internet marketing. But when you look at pricing and taxes and pricing strategies and all those, they fall in line with marketing. So at community level policies, without going into great detail, to begin with, Supreme Court Justice Brandeis talked about how local communities are really laboratories of democracy. So the things that happen in local communities and changes that happen there get scaled up eventually. So the work that you do to change sometimes seems small, but it has a great impact long term. And some of these policies that would affect the way sugary drinks are marketed include product sales and marketing at schools. And we think of marketing in many different ways, as I mentioned earlier. But for example, there are things that, like for Gatorade G2, that fits in what should be marketed at schools, for example. But you're really marketing the brand for Gatorade for all the products. So as long as that G2 is there, it can be believed to be a healthier choice, and that can leak over to other products that are similar to it. The other way we can do something about marketing to kids and the influence is dealing with supermarkets and convenience stores. And taxes, minimum pricing, and having healthy checkout aisles or some of those things, or prohibiting where food is sold. And some of these things have this trickle-down effect, so they might be able to really go for, you might be worried about sugary drinks, but you could really attack unhealthy food marketing or unhealthy food sales, junk food sales, in many ways when you deal with these things. And window sign restrictions could be one of them, because you need to attack that for aesthetics or for safety, because we have to worry about freedom of speech when it comes to marketing. And so if you put restrictions on that, you might be able to sort of deal with the marketing of a whole host of unhealthy foods. And then there's restaurants that can make a difference on standards for kids' meals, labeling, menu labeling, and also local restrictions in zoning. And then billboards that could have warnings, or you could tell restaurants they can't advertise on other places other than their locations. And there are a variety of other ways to deal with marketing. But the good thing is that community support is really growing. So we've studied parents' attitudes towards different policies. And what we found in this more recent report here is that from 2012 to 2015, there was really a lot of growth in support for portion limits and also for SSB taxes, and then also for SSB sales near schools. So about half of parents supported those policies in 2012, and then you can see what the numbers are a few years later. Thank you.
Well, good morning. It's great to be here in New York, and it's even more great to see how packed this room is and the room next door. I've worked with many communities across the country working on sugary drinks, and to see this level of engagement at this stage of the work is truly impressive. It speaks to the point that Javier made of having strong, vibrant coalitions that's essential to driving this work forward. So congratulations, New York. Way to go. So what I'm going to do is talk about what I've seen across the country as the most active and promising sugary drink strategies, and then make some of my recommendations about what I think the most potentially effective and impactful ones might be. I kind of put them into three buckets: the things that will decrease the affordability, the acceptability and appeal, and the availability of this unhealthy product. And breaking it down a little bit more, you can see in each of these categories there are multiple options to consider. As Nick said, having a multi-pronged approach makes sense because it's a complex issue and there's not going to be a single silver bullet. So if you look at affordability, we've deterred about taxes, and I'll come back to this, but there are also institutional pricing strategies where institutions can selectively raise the price of some products, decrease the price of healthier products like water. There are many approaches to changing the acceptability and appeal, and I won't read these all to you. And I think perhaps some of the most popular, potentially because they're the least politically difficult, are working on availability at a wide set of community institutions, including hospitals and government sites, and so on. But I also add to this list the emerging strategy of product reformulation, which I'll come back to in a minute as well. So how do you pick between all these different kinds of strategies to figure out what should be in a portfolio for a given community? What I tried to do is summarize my thinking on this slide on two sets of criteria around these strategies. One is what is acceptable to a community, would generate community support, and is feasible politically and otherwise. The second criteria is how impactful is a given strategy going to be, and how strong is the evidence that the strategy is actually going to work. So if you look at the ones in blue, those are ones that the evidence base at this point is lacking. It doesn't mean they necessarily won't work. We don't have evidence that they don't work. But likewise, there's not evidence that's strong at this point that they do work. If you look at the ones in green, those have limited or even more substantial evidence of impact on sugary drink consumption and norms and attitudes about sugary drinks. The ones that have the strongest evidence in that group are media campaigns, the work that's happened to take sugary drinks out of schools, and sugary drink taxes. So I would consider, as I think about this, both of those dimensions for what you might choose when you're thinking about it for New York. And I'm going to go into three of them in a little bit more detail, which I think are particularly promising. We've heard from Javier, and I endorse the comments that he made. Sugary drink taxes are a quite potent tool. They not only reduce consumption, they increase awareness about the adverse health effects of these products through both the campaigns and the earned media, and labeling a product as worthy of taxing as a sin tax. They also generate revenue to support important community health and well-being programs and activities that Javier mentioned. And that's probably the strongest selling point of these taxes in a political campaign. They are predicted, although it's too short term to look at the health consequences around diabetes or obesity and so on, but modeling studies show substantial health impacts. And emerging is that they actually are turning into be a tool, and I'll show you an evidence point on this, around inducing industry to reformulate to lower sugar products. So right now in the U.S., we have 7 jurisdictions which are implementing taxes across the country. We lost one tax, as you heard, which we can talk about in the Q&A in Cook County. We're in touch with probably about 10 other jurisdictions at this point who are seriously considering and going down the path towards taxes in 2018 and 2019. So this movement is vibrant and alive and moving forward. And it's a global movement. I won't go into the details on this, but hopefully you'll get these slides. But this shows that around the world, there's a groundswell of nations adopting sugary drink taxes. Most recently, we saw South Africa join this group. Coming to reformulation, the UK has a tiered tax system where the highest sugary drink, or the sugary drinks with the highest sugar content, are taxed at a higher rate than the middle tier and the lower tier. And what we're seeing is the drink companies there, Coke, Pepsi, and others, are actually reformulating and reducing the sugar content of their beverages. So by default, people will be having exposure to lower sugar products. Let me mention 2 other briefly, and before I conclude. One is working with hospitals. There's a growing groundswell for removing sugary drinks from hospitals. Hospitals have the obligation to do this because they're health institutions, and they are big employers in their communities, and so they can affect a lot of employees. UCSF was one of the first hospital systems to totally ban the sales of sugary drinks on its property, and that's whether it's in vending machines, cafeterias, retail locations, fast food places on campus, and even patient menu catering events. And they're just beginning to publish evaluation data. And what I point out is this is 24-hour consumption, not just at the workplace, but also at home. And particularly, the greatest declines in consumption, if you go to the 4th row, are the service and maintenance staff, with a 16% decline in consumption. And these are the vulnerable populations who drink the most at baseline and have the most to gain from an equity perspective in reducing consumption. The last strategy I'd like to call attention to is one that New York City's blazed the pathway and pioneered with pouring on the pounds, if you remember, in some of the other campaigns. This work has been picked up. Actually, your former commissioner did another study called Living Sugar-Freed in Appalachia, which has some decent evaluation data showing a 3 or 4% decline in sugary drink consumption due to just a 15-week campaign there. So I'll conclude here. If you want more information, we have descriptions of all these policies and strategies and more on our Healthy Food America website. We're a national organization based in Seattle that provides technical assistance to communities working on sugary drinks, and I look forward to the discussion period. Thank you.
Good morning. Good morning. There we go. My name is Juan Gonzalez, as Jim had mentioned before, and I work with the Children's Day Society, and I've been privileged enough to be part of this organization for 15 years this summer. And for those of you who are not familiar with the Children's Day Society, it's a nonprofit organization that has been around since 1853. That means 8 years before the Civil War began, just to give you a sense of perspective. And the reason why, in essence, I've been invited here today is to share how we at the Children's Day Society have been able to frame our conversation around sugar-sweetened beverages. And for you to understand what that means for us, it would be good to understand a little bit about how Children's Day sort of operates. We, as a mission, even though we are 165 years old, our mission has not changed, and that has been to help children in poverty to succeed and thrive. And we do that by providing services across the board in 40 locations, from Westchester all the way to the northern shores of Staten Island. And those services are provided through divisions, which encompass prenatal and early childhood. We have school age for all the elementary and middle schools, adolescent divisions for all the teens and young adults who are about to enter the workforce, health and wellness, which services clinics and nutrition education across all these different programs, child welfare and family services, which encompass everything that has to do around foster care, and the National Center for Community Schools will work in tandem with the community schools right here in the city. So our work brings us all the way from schools to centers to people's homes. So we are, in essence, in those neighborhoods that we service. Now, as you can only imagine, it's a big endeavor, isn't it? Now, when we're looking at the Children's Aid Society, we have a whole series of programs, and those are encapsulated within the Health and Wellness Division. It's what we call our Go Healthy initiative. And those are basically 5 programs based in 29 sites, servicing around 11,000 children, providing 500,000 meals annually, and some of them are made from scratch. So that's an impact, isn't it? And what that means for us is that there is no way that we can base our conversation about sugar-sweetened beverages from a place of limiting things. It can't be housed in that. It needs to be housed around conversations of education and collaboration, because we cannot in any way, shape, or form be the food police. So let me show you what that looks like on the ground. It's based on conversations with the little ones, right? Showing them what the impact of sugar is, but more importantly, to appreciate fruits and vegetables. And here we got a couple of cooking classes, and look at the level of dexterity in those knives and conversations that they're having around the table. And we show them how with just a few fruits, a little bit of water, and a little bit of milk, you can create that alternative to what they're normally may be encountering elsewhere. And that's the fun part. Look at that. And when we ask them, do you enjoy the experience? Because in reality, for the children, it's about enjoying. That's the result. So we even have children who have taken it upon themselves to teach others about what it is that they do. Here we got the Snack Shack menu. And more importantly, we have with our school age division competitions and things, so they learn how to include things like flavored waters and infused waters, and learn how to make them for themselves and for their own families. Just to give you an example, that was part of our competition to see which one won. And of course, collaboration comes in the forms of the centers themselves. After we do classes and we have conversations with them, they are the ones who are putting the posters up. They are the ones coming to us in those centers where they need to have vending machines, to asking our Go Healthy program to be part of that conversation. So it's not us dictating to them what they need to do. It's in collaboration with all of them. And when they mention going out into the neighborhoods, that's where we are, providing those services to our Eat Smart New York program and to our Go Sheds program, having conversations with the people who live in those communities and showing them alternatives. But more importantly, that conversation happens from early childhood all the way to the adults. It's not a one-time thing. This is something that we have been doing since 2003 when the program began. Our conversation moved to the school age division in 2008, and our healthy beverage policy didn't come into place until 2011. But by then, education had already happened. Collaborations were already set in place. To the point that staff, when we launched that healthy beverage initiative, they were the ones celebrating and created special cups to commemorate that in one of our sites over in the Heights, PS5. But in the end, this is what it's all about. It's engaging the children in education, having them learn, having them have fun, so that they can internalize that for themselves. It's about having them grow up healthy, strong, vibrant. And this is something that we take very, very seriously. And I come from a design background. The reason why I came into this work around health education was because I was about, in 2002, to become a new parent. And I did not know how was I going to bring up a healthy child. So for me, it became imperative to switch, and nutrition education became that design project 15 years ago. And I'm proud to say that the work that we have done collectively and collaboratively have yielded some very interesting results that we see not on the statistics, not on research, but on those families coming back and saying what we have been able to do together has yielded results. And I take that personally because I am one of those people who have seen family members be part of that statistic, who are no longer here because they died of chronic disease. And I said to myself, I don't want that in my own family. So I learned. And now I get the pleasure of sharing that, some of that knowledge. And when I say that, I take that very seriously. I mean it. You see those 3 little girls right there? I know each and every one of them. That picture was taken in 2006. They were 4 years old. Right now, they're all of them 15, 16 years old. The one in the middle happens to be my daughter, who was in one of our programs. And I'm proud to say that she's a 15-year-old young adult who's vibrant, who's healthy, and that this conversation, it's a non sequitur. It's not even a conversation anymore because she has the knowledge of what to do and to make her own choices based on health. And that's it. Thanks.
Thank you so much. Fran, you want to come back and join us? And Jim and Juan Carlos. So I'm going to ask a question or two of our panelists, and then we're going to open it up for questions from you.
Mm-hmm.
Okay. So, Jim, first question for you. You recommended several strategies for New York City: taxes, reformulation, institutional policies, and public awareness campaigns. I wonder if you could talk a little bit about how you think counter-marketing might fit in with that, and what we have learned from work on the tobacco industry, where denormalizing the practices of the tobacco industry and making them not legitimate participants in public policy helped. Do you think there's a role for that in sugary beverages, and do you have examples of jurisdictions that have added that to these other strategies?
Yeah, Nick, that's an excellent question, and I think the answer is yes, yes, and yes. I think there were 3 questions there. I think that counter-marketing has been shown to be quite effective in reducing the acceptability and consumption of tobacco products. And I think the same is likely to, when it's implemented, if it were implemented in the case of sugary drinks. And we have some evidence now from the study I mentioned that Tom Farley did in Appalachia to that effect. Counter-marketing at its core goes to, as Nick said, not only denormalizing industry, but demonizing industry. And I think there's debate in public health circles and community circles. Do you really want to make industry the bad guy? And I think the answer is yes. We've learned that that technique is effective during the course of tax campaigns and other public policy campaigns. And it also generates a lot of attention that way because media loves controversy and gets the message out through free earned media that these are harmful, defective products. Where have we seen this? Besides Appalachia, I think another example I like to point to is in the Bay Area of the Open Truth Project, which works with youth in the Bay Area to generate poetry and videos. If you haven't checked out their website, very impressive young people. Counter-marketing particularly is a good youth engagement strategy, and particularly one that can work at the grassroots level as well as in the context of a large paid media. In Seattle, where we have passed a tax and we're starting implemented in January 1st, our Community Advisory Board is considering investing a substantial amount in the counter-marketing campaign on a large scale in Seattle, and we will evaluate that and look forward to see how that works out.
Fran, my question for you sort of picks up on some of those themes. We know that sugary beverage companies are skilled at creating messages that have a wide appeal. You showed us some of those images and messages. And I wonder if you think there are lessons on messaging that advocates can learn from the industry. And what do you think are the key messages around sugary beverages that public health advocates should focus on?
Thank you. I'll keep this closer than I did for my last rap battle. Anyway, yeah, what we've seen from industry is limiting choice, as people have pointed out here, and that they are offering choice. And then the way that I think that we might be able to go get at that is, and we do a lot of work on marketing to children. So let me just start there. But one of the ways to combat that is to talk about how the industry undermines parents' authority. Parents want to believe that they make choices for their kids. And I think a strategy there would be to figure out a way to say, hey, they're saying, oh, do you want the government to tell you what to do, what to feed your kids? But do you really want industry giving you advice about what to feed your kids? They just really want you to buy more of whatever they're selling. They're not in the business of public health. They're in the business of, the bottom line. The other thing that I was going to mention, as mentioned earlier, is taking some, looking at the Truth campaign that was done for tobacco, because that was a successful campaign. And having said all that, a lot of things were changing at the same time for smoking too, but it was a successful campaign. The other thing that we're hearing from industry is about offering smaller cans, and that is, again, increasing choice. In an analysis of that, we found that those really just make more money for industry. They charge more for them. So maybe pointing out these types of things when they come back with something, be prepared to say something else. And also, those aren't really sold in vending machines and at corner stores where people are buying sugary drinks. And then the last bit is really, in terms of messages, a one-size-fits-all might not work. I do a lot of research on targeted marketing and the effects of it. And what we find is that there is even greater support among parents, Black and Latino parents, for policies to reduce the marketing of unhealthy foods. So maybe dealing with that as a food justice issue, a social justice issue, as others have pointed out, it could be the right approach in certain communities.
Did you want to add something?
Yeah, thanks, Fran. That was excellent. I think one of the lessons also learned during the policy campaigns is it's important to, while not spend most of your energy countering industry messages, but really pivot to the positive benefits to the community that these policies are going to bring. So in the case of taxes, as Javier mentioned, it's what are the benefits that these dollars are going to bring to supporting programs that community members want to see happening in their communities. That said, I think it's important to also point out the rogue behaviors of industry and make them analogous to the rogue practices of the tobacco industry, which is kind of an outlaw industry at this point. And you can point out many parallels in the same tactics and strategies that these industries use, whether it's targeted marketing, whether it's buying off scientists and community groups, whether it's creating doubts about sound science and so on. And finally, there are a couple of key arguments, I think, that are potentially being prepared to rebut. Industry's primary argument right now is that a calorie is a calorie. All you've got to do is cut down on those calories and be more physically active, and sugary drinks are just fine as a part of your diet. That is not scientifically true, and putting out the science on the unique harms of sugary drinks, independent of their calories, is an important message. And finally, emphasizing the inequitable, unjust impacts of these products on communities of color and low-income communities is also an important part of the messaging.
Great, thanks. Juan Carlos, thank you very much for your presentation on the wonderful work you're doing at Children's Aid Society. I wonder if you could talk a little, What's been your experience, and how do you think about the connection that you do in your own food programming and the day-to-day programming for children and families, and engaging your constituencies in some of the policy work around city policies? Have you been able to take on those two different levels? And if you had advice to give other organizations in the room about how to think about the connection between those two bodies of work, what are your thoughts?
Personally, I cannot speak much around the policy aspect, and I'm going to say a little bit more about that education and collaboration aspect, which is what, in essence, as I mentioned, had worked for us. One of the things that, historically you tend to see is when certain policies or certain campaigns sort of come to the fore, sometimes you scratch your head and say, when this was being thought about, did someone come to the actual neighborhoods in which now the campaign sort of lives in order to engage, right? Was there any education that happened previously in order to create that particular campaign? So when it comes down to advocates, whether that's the different organizations that are here in the room or those that are out there, the thing my take would be spending a little bit more time in that education, but from a point not of this is what you need to do, but more from an empathy aspect. It's about educating people around understanding what that glycemic response actually does. What does that mean as a human being? It's around reading labels so that that person can understand for themselves what it is that they're about to not only put in their bodies, but going to purchase for their own families, and letting them decide what their stance is. It's around simple language so that people are not confusing themselves far more than they need to, because sometimes we see that even in our own work, where even mixed messages sometimes percolate into the work. It's about having clear guidelines so that there's no loopholes and that everybody knows sort of where they stand. So in that encapsulates sort of education. And I would say in terms of collaboration, there's a lot of very bright minds around. Tap into that. Have those conversations. I mean, we do that internally. I mean, we have friends in Lehman. We have friends in Brooklyn College, at Hunter, at the graduate, right here in graduate school. We have those, and those conversations don't happen in a vacuum. We engage with everyone.
Great, thanks. And listening to you, it seems to me that the lessons that Javier was presenting to us, that having that conversation in the community, that organizations like yours are one kind of place where those conversations can take place. And the conversation, if I understood you right, Javier, are very much two-way conversations. They're not public health folks saying, as you were saying, here's how it's going to be. It's talking to each other so that we understand our concerns and we can come up with strategies that speak to all those concerns. One more fast question, and maybe each of you can say a few words about this. And then again, for people in the overflow room, if you have questions, if you write them down and send them in, we'll present them to the panelists when we open it up for questions in a couple minutes. So public health folks spend a lot of time thinking about the right balance between negative messages. In this case, if you drink too much soda, you're going to die prematurely, and positive messages, drink more water and you'll live a long, healthy life. And I wonder what you think in our work around sugary beverages, what's the right balance between negative messages and positive messages, both in education but also in policy advocacy?
Well, I'll be brief to give others a chance, but when we look at health campaigns and theory-based ones, there's a process there. So people need to recognize that there's harm, that the action being proposed will reduce the harm, and know what to do, and then successfully believe that they're going to be able to perform the action. So I think in terms of thinking about the balance, I think what you want to do is not only tell people what not to do, but tell people how they can do it. And the examples of offering options for other types of drinks or making the healthy choice the easiest choice, and those types of things, rather than a just say no approach, is really important.
Yeah, I would agree and concur with what Fran said. They're complementary strategies and they go hand in hand. I don't think you should do one without the other. It makes no sense to promote water consumption, for example, independently, because there's no real evidence that if you increase your water consumption, your sugary drink consumption will go down through a water promotion campaign. On the other hand, you shouldn't just promote a tax campaign or another policy encouraging people to decrease consumption without providing a positive alternative, as Fran just said. The other couple of quick other points I would make is that I think there's some key gaps in people's knowledge and awareness that can be helpfully incorporated into messaging campaigns. When most people are aware that drinking soda, for example, is bad for you, there's much less awareness about fruit drinks, and particularly these fruit drinks are consumed heavily by kids, and particularly the favorable attitudes towards fruit drinks as healthy products, because of the targeted marketing, are higher among communities of color. So getting the word out about that, I think, is really important. So those are my comments. Off to Juan.
In regards to this, I would have to say again that what had worked for us has been to frame that conversation on the healthier side of things. That being said, it's not that we shy away of saying, okay, the consumption of this, and that can cause X, Y, and Z based on what the studies say and blah, blah, blah. But the conversation really is about how to incorporate healthier beverages, healthier foods, based on the landscape, whether that's from a socioeconomic, whether that's from a cultural, that's from an educational standpoint, or where our recipients in terms of information come from. And the only way to do that is engaging them in a conversation. So those trainings that we do, they're more than anything conversations, and that's what tends to work, because it's a dual thing, and you're learning at the same time that you're teaching, if that makes sense. Yeah.
Great, thanks. So we're going to open it for questions now, and the format will be, we'll take 4 questions, and the more succinct you can be, the more rounds of questioning we'll be able to do. After we've heard 4, I'll ask the panelists to comment on whichever questions you have something to say about.
This question isn't necessarily directed towards anyone in particular. I'd love to hear any of your opinions on it. But I'm wondering, going forward, presuming that this does work in terms of campaigns against sugary drinks, what if the beverage industry comes back to fight against that with presenting other alternative sweeteners that aren't necessarily as healthy as sugar? Have you considered anything about that?
I could ask, I'm sorry. In this era of fake news, I know that we always try to point to the facts, but again, there's a lot working against facts and science. I was just wondering if people had any recommendations and tips about how to frame some of this sugar-sweetened beverage language.
My question is specifically for Jim regarding the Seattle tax. It's significantly higher than what we've sort of seen been adopted. I just want to know how you guys came up with the $1.75 per ounce instead of going a little bit lower.
I have one from the other room. Nick, over here. I can read it. Sure. It says, one of my concerns about the standard sugary drink policy solutions is that they target consumers. Example, labeling, taxes, portion sizes. How can we instead hit beverage companies' bottom line? For example, through boycotts, divestments, taxing shareholders of beverage companies. The climate change movement has had some success with divestment.
I'd like to start with the last one, and mainly because I'm considering some of the work that we've done on support for policies. I know that you're all thinking about policies that would occur in your own communities, but we are also finding an opportunity to work with parent groups to have that might work in terms of thinking about these on a bigger scale of change. What we're finding is that parents are more willing as time has gone on, since we've measured this since 2009, to participate, to write letters to Congress people, to write letters to the industry, to send emails. And just because you're working in a community doesn't mean some of your strategies don't have to go bigger. You can gain support from parents to take these actions, and also work with media to get coverage of these, to sort of spotlight industry, I think, and show what they're doing and what you're doing about it in a bigger way beyond your communities. I'd like to get someone else.
That was 4 great questions, so I'll try to cover some of them one by one. With the last question, hitting big soda. First of all, the tax strategy hits big soda's pocketbook because sales decrease and they have less revenues and profits. But I think there is a viable path forward for a shareholder resolution, anti-corporate kind of strategy as well. And indeed, there are discussions going on about that right now, and I'm happy to talk about that offline. Shareholder resolutions can be important, as we've seen both in the anti-corporate McDonald campaign that was recently done by Corporate Accountability, and the success of some of the tobacco campaigns as well, which can ultimately lead to investors and pension funds pulling out from stocks, and also from some of the other tactics that you talked about. So I think that is a strategy we should be following. In terms of the Seattle tax rate is 1.75 cents per ounce. Boulder's actually higher at 2 cents per ounce. We decided upon that rate for 2 reasons. One is to raise sufficient revenues for the community programs that we wanted to support. That tax rate generated the revenue needed for early education and for healthy food access programs in Seattle. And second, that tax rate would raise the price by at least 20, if not 30%, and that's sort of a minimum or a threshold which will have substantial public health impact. So those were the 2 considerations. Finally, in terms of the alternative sweeteners question, complicated topic, my bottom line on that is the evidence of harm from sugar is much more strong and robust scientifically than the evidence of harm from non-nutritive artificial sweeteners. And there, from a public policy point of view, people have got to cut down on the sugar and stop being exposed to so much sugar in our food supply. But we also should exert caution. We just don't know yet what the long-term health effects of these are, but they might be less harmful, they might be more harmful. When I talk to my patients in my clinic, I say the best thing is drink water, drink unsweetened teas and coffees, and don't drink anything with artificial sweeteners or sugar. But if you can only cut back and you have to have a diet soda, at this point the evidence is probably that's a harm reduction strategy relative to drinking full sugary drinks.
I would like to answer based on the sweeteners and the fake news. I'd say that once you arm, whether that's a child, a staff member, or an adult, with how to interpret information in a way that makes sense, they will be able to make certain decisions on the spot. And that we have seen in many cases. I'll share an anecdote. And this happened about 2 days ago. I was in one of our sites, and one of the staff members came up to me and said, after learning how to interpret what grams meant in terms of packets of sugar, I knew how much I was actually consuming. And I used to be able to drink X amount. She told me how much she was actually consuming. And now I'm no longer doing that because I know that may not necessarily work for me. So that person started making their own modifications to their consumption. But based on what? Not because we told them this, that, but because they had the information at hand on how to interpret it properly.
I just wanted to add a few thoughts in response to the question, the 4th question, on focusing on the industry. I spent a few days at the end of last year in Mexico City working with a group called El Poder de Consumidores, which is the group that led the fight, the successful fight for a sugary beverage tax in Mexico. And their current effort in trying to extend and increase the tax is to focus on the conflicts of interest that the industry experiences and their undue interference in the political system through lobbying, campaign contributions, both over the table and under the table. And their goal is to delegitimize the sugary beverage industry as a legitimate player in politics in Mexico City, a place in Mexico where they have a strong influence. And I think Center for Science and the Public Interest, which is represented today, has been playing that role in the United States as well as really focusing attention on the tactics of the sugary beverage industry as well as others. So that might be another idea. I think we're going to end this portion because we want to be sure to have people to have time to talk to each other and to begin to come up with some strategies of how we can move forward. Is Craig around? Yes. Do you want to explain what happens next?
Sure. We're going to take about a 5-minute break just so you guys can chat amongst yourselves and get something else to eat if you'd like. And then we're going to move into the workshop phase. And during that period, you'll notice on your tables there are 3 different large Post-it notes. And we're going to put up 3 questions on the screen. And what we'll ask you to do is to talk amongst your group to figure out what do you think is the best answer to these questions and what are some of your solutions for crafting SSV policy in New York City. But first, take a few minutes to relax and think through some of the things you've heard, and then we'll pick back up again.
So it's 11:04, so maybe at 11:10 we can be back at work at the tables.
Okay, everyone, so we're going to, if you could take your seats as soon as you have a moment, and we're going to start the workshop portion. Okay, so if you could take your seats, please, we're going to get started. Additionally, we're sending around the sign-in sheet. If you haven't already signed in, please make sure to sign in. Okay, so for the workshop portion of today's roundtable, we're going to enter into a discussion about SSB policy amongst our colleagues. So the plan here is to discuss the following questions with your group. Use the paper that's on your desk to answer answer the questions. And the idea being that of the three questions, among yourselves, come to a conclusion about what you think is the best answer, your best or favorite answer, and put that answer on a separate Post-it note from the white sheets of paper that are on your table. And in the end, you send someone up to the front to stick your answer on the larger Post-it notes that are here on the left side of the stage, next to the respective answer. So the questions are, and I'm going to leave this up on the screen so you'll be able to reference it. How might policies be framed to garner the most support? What opposition might arise based on what you heard today or what you might imagine, and how might you counter-argue? And lastly, what can you or your organization take, what action can you or your organization take in your community to support sugary drink policy? So these are the three questions that we want you to think about. Draft answers on the scratch sheets of paper, the white paper, and then put your final answer to those three questions on the three Post-it notes, and place those Post-it notes here on one of the three signs. And at the end, we'll review and talk about some of the answers and see what emerged. Also, I'll be circling around, and some of my colleagues, and also if I could ask some of the advisory committee folks who, if you could raise your hand if you're a member of the advisory committee. 1, 2, 3, Greg, Jim, and Adrian. If you guys could circle around as well and answer any questions or provide any prompts should anyone be stuck, and you obviously see who I am. I'll be walking around as well. If you have any questions, feel free to ask. And we're going to take about 20 to 25 minutes to work on this. Okay. Thank you. So about 10 more minutes, everyone. So start to gather your ideas together.